Okay, now it's my pleasure to introduce our speaker, our morning speaker. I'm going to introduce Dr. Vickie Petz Kasper. Dr. Kasper practiced obstetrics and gynecology for 20 years. With 2 decades of medical practice, a profound personal battle with myasthenia gravis, and insights gained from hospital administration, Dr. Vickie brings a unique perspective. Now she is helping others take control of their health journey through her lifestyle medicine podcast, Healthy Looks Great on You. Please welcome Dr. Kasper.
I don't know about you, but for me, it was a moment, a single moment in time when I knew without a shadow of a doubt that my life would never be the same. And whether your story is one of gradual realization or like me, you have sort of a dramatic story, we all have a myasthenia gravis story. And for me, MG threatened to define who I am. But I have a very wise mother, and she always said, oh no, your circumstances do not define who you are. They reveal who you are. And the revealing, well, that's always a process. I like to think of it as an unwrapping. And I am so glad to be here and to belong to this group. It's been a lot of years since I've been involved with MGFA, but it was a lifeline for me when I discovered all the resources that were available to me when I was diagnosed 10 years ago. I'm glad to belong. And I've heard several of you use this term, club. I'm glad to belong to the club that nobody really wants to be in. And last night at dinner, we were walking in and they were separating us into 2 groups. You go this way if you're part of the event, you go this way if you're not. And there was a group in front of us, and the person that was there guiding them said, are you part of the group? And they said, I wish. And I'm like, you sure about that? I don't think you want to belong to this group. But I am thankful to belong. But you know, none of us signed up for this, right? I didn't sign up for this. Did you sign up for this? Did you sign up for this? Who signs up to have a disease that's hard to pronounce and nobody's ever heard of it? And weakness? What does weakness look like? I mean, it's not like you can go to the doctor and they'll stick an otoscope in your ear, look and say, oh, I see weakness in there. They can't put your body in a scanner and say, I see a little weakness there, and there's some weakness there, and there's some weakness there. Sometimes you wish, right? Weakness is invisible. And I remember the first time I was in an online group and I heard someone say they had that MG feeling. Is there anybody in this room that doesn't know what I'm talking about? An MG feeling. And I was so excited that somebody gets me, that somebody understands what it's like to have gravity turned up about 10 notches. It was so validating that someone understood what MG felt like. So how did we all get so lucky? And is there an unsubscribe button? And I believe that's what all of this research is about. Aren't you thankful for all the progress that we're making to try to find that unsubscribe button? Because so many times I wanted to hit the rewind button. Now, I don't know if you've seen this movie or not, but Tim Allen plays the Santa Claus in the Santa Claus movie. He is actually becoming Santa Claus. And what's happening is he's gaining a bunch of weight and he's growing a bunch of facial hair. So I wonder if they just had him on a high dose of prednisone. Because I know what that feels like. And as this is happening to him, he says, can we take a direct flight back to reality, or do we have to change planes in Denver? And I get that. I just wanted to rewind and go back to my old life. So I'd like to introduce you to my pre-MG self, because myself thought she had a pretty good life. I mean, I had it all. I had a very demanding but exciting career that I absolutely loved. During my career as an obstetrician gynecologist, I delivered 5,000 babies. Thank you. And it never got old, not even during the middle of the night, because I'm going to tell you right now, nothing compares to the feel of newborn baby feet, except maybe the look in a mother's eyes the first time she touches them. Very rewarding career. I was married to my high school sweetheart for 3 decades, and we had a beautiful family in our beautiful life. Mom, dad, boy, girl, and a dog named Sammy Joe. I had it all. I had pictures on the walls of my office of my smiling face holding newborn babies, and pictures on the walls of my home of the smiling faces of my family members. Now, if I'd have looked a little more closely, I would have noticed that more than a few things were crooked. But I had a good life. I was 50 years old, and I was more physically fit than I had ever been, thanks to a method called Tabata. I don't know how many of you like to exercise, but I love to exercise. And Tabata is a process where you do 20 seconds on and 10 seconds off. And I'm the type of person that thinks I can do anything for 20 seconds. And so through this method, I got very, very fit. We would do 80, that's 80, Army-style push-ups every Friday morning. I was fit and I was strong. And each day, my typical day was I would slosh my coffee around, run to a meeting, run to the hospital, make rounds, go to my office. And I saw so many women who shared their deepest fears and insecurities with me, the intimate details of their lives. And I doled out advice, physical advice, mental advice, emotional advice. And it's a really good thing I had all the answers, because one day I fell off of that stool and landed on the other side of the sheets. But before that, I was very fit, and I always like to set goals. I am a goal setter. And so every year I had a birthday goal. And so, oh wait, I've got ahead of myself. No, there I am. I had a birthday goal every year. And so for my 48th birthday, I decided that I wanted to ride a century. I was really into road cycling. I pedaled my bicycle about 100 miles a week, but I decided I wanted to ride a century. That's 100 miles. And so I did a ride called Horonjeff. It's a real race. It's about 10,000 people participate in this. It's in Wichita Falls, Texas. And it's 100 miles in 100 degrees in one day. And I did it on my 48th birthday. And I can tell you that even if I were physically able to do that again, I want nothing to do with it. It was horrible. I think I sat down in an anthill after it was over, and I was too tired to even get up. Mark that off the bucket list. For my 49th birthday, I decided that I wanted to do a sprint triathlon. And the reason it was a sprint triathlon is because I'm a terrible swimmer, and I really wasn't a good runner, but I had a puppy, and that puppy was teaching me how to run. And so for my 49th year, I did a sprint triathlon. I was the last one out of the water. I passed everybody on the bicycle, and they passed me again on the run, but I finished. But for my 50th year, my 50th birthday year, I decided that I wanted to do a multi-day ride, and I chose the Katy Trail. The Katy Trail is one of the largest rails to trails projects in the United States, and it goes across the state of Missouri. It's 257 miles. And what they've done is they've pulled up the railroad tracks and they've replaced it with crushed limestone. And so people ride their bicycle from little depot town to little depot town, and they've got all these eclectic bed and breakfast and restaurants along the way. And I decided that me and my daughter and my 2 cycling buddies would do this trip unsupported, which is a really bad idea, over 5 days. And so for 6 months, I studied the official guide to the Katy Trail. I had reservations everywhere we were going to do. And I had the rest stops planned. I had every detail planned out. Now, 2 days before the trip, I did something that very few women have ever accomplished. I packed for a 5-day trip in a bag the size of a lunchbox. Big accomplishment. That was 2 days before the trip. The day before the trip, I had to get some babies delivered. And so I had 2 scheduled repeat C-sections. And in the middle of the second C-section, my hands suddenly refused to obey my brain. And I kept looking at them, expecting them to move, and they were just still. And my partner looked at me over that mask that covered our mouth and nose, but our eyes spoke volumes. And she reached across the open abdomen and took the instruments out of my hand. And I felt like concrete was pouring into my body from some unseen source. And my thighs felt like I'd held a squat for entirely too long. And so I backed against the wall and surrendered to gravity and slid to the floor. This newborn baby was screaming and crying, which is always a good sign. The monitors on the mom were beeping. Dad was over there just grinning. And I was in the floor of the operating room. And that concrete began to make its way down my throat into my chest, and I was struggling for every breath, not really sure how long I could continue the effort. And one wheelchair ride transitioned me from surgeon in the operating room to patient in the emergency room. And in that moment, I knew without a shadow of a doubt that my life would never be the same. Now, my diagnosis was not a mystery. That had happened about 6 weeks before. 6 weeks before, I was riding in the back seat of a car when I glanced in the rearview mirror and I noticed that my right eyebrow was perched like a caterpillar above my sunglasses. And I thought my sunglasses were crooked. So I took them off and I readjusted them and I put them back on and I looked in the mirror and that caterpillar didn't budge. So I took my sunglasses off and I adjusted them again and I put them back on. And finally I had to admit my sunglasses were not crooked, but my face sure was. And so I went home that night and I laid down on the floor to take away the cruel effects of gravity. And I took a selfie of my eyes and I sent it to my primary care doctor by text message. And I said, do I need to see a plastic surgeon or do I need to have an MRI of my head? And he said, well, I don't know, but I have a buddy who's a neurologist. Let me call him and text him. And I'm just telling you, there are many times over the last 10 years that I wish I had a buddy who was a neurologist and I had their cell phone number. Anybody want to volunteer? If you're in the room, we've got some neurologists. But he texted that picture to his friend who is a neurologist and he said, that is myasthenia gravis. So they sent me to the hospital and I had some blood work done and it didn't show a thing. And he said, that's still myasthenia gravis. And so he sent me into a neuromuscular disease specialist and they told me that there was an 85% chance it would progress to the rest of my body. And I began to experience an emotion that was totally foreign to me. And that's fear. I was so afraid that this disease would take away everything I loved about my active life. And that day in the operating room, my worst fears and more began to come true. And I was in the emergency room in a hospital where they knew me, but they didn't know how to treat my disease. And so they transferred me to another hospital where they knew how to treat my disease, but they didn't know me. I was just a patient in room 421 with myasthenia gravis. And I laid in that hospital bed, limp as a rag doll in a gown 3 sizes too big. And if you've known me for very long at all, limp as a rag doll is the opposite of my personality. I'm in constant motion. And they started pumping me full of the evil, wicked drug prednisone. And every day, the attending would come into my room with a complete entourage of medical students and interns and residents and maybe some people that worked in housekeeping. I don't know. They brought a room full of people in to watch my circus trick. And she would hold her finger up like this for a full 2 minutes and watch my eyelids drop like curtains. And I didn't mind. I know that people need to learn. It's fine. And then she would test the strength in my arms. But what she did is she tested my biceps, and she would have me resist one time on this side and one time on this side. Did I mention that I was strong? Because I did to them. I'm not sure they were listening. When she left the room, I could not get my fork to my mouth, much less chew my food. And this went on every day for 5 days, the same 5 days that I was supposed to be pedaling the Katy Trail, but instead I'm laying in a hospital bed. And on the 5th day, the doctor came into my room with her entourage and accused me of faking. Now, I have faked being well, but I have never faked being sick. They knew how to treat me correctly, but they didn't treat me right. Let me go back. They didn't know that I pushed myself to the limits. They didn't know that in 20 years I had never had a sick day, although I did go in a little bit late one time because I had food poisoning. They didn't know. Oh, I got my slides off here. I have them off on my slides. I'm sorry here. Here we go. They didn't know me. They just knew how to treat me. And I'm telling you right now that being betrayed by my own profession was a wound that was nearly as painful as the disease that I now had. And that was just the beginning of loss. In that instant, my career ended. Not long after that, my marriage ended. My appearance changed. I had 8 pounds on each collarbone, a little mustache as a bonus, and I don't know what that face looking back at me in the mirror was. Full as a moon. Y'all know what I'm talking about. I lost the ability to do all of my active hobbies and everything that I loved about my picture perfect life. And instead, I spent a couple of years in a recliner, conforming to the shape of a C, with my dog at my feet, and my legs and my arms limp and weak and useless with no purpose. At least that's what I thought. And what about you? What have you lost because of MG? I know that many of you have had losses, big losses, small losses, and maybe like me, devastating losses of nearly everything. And that's your MG story that turns your life upside down. But remember, your circumstances don't determine who you are. Your circumstances reveal who you are. So we're going to rewrite your MG story. That doesn't mean we don't want to rewind back to our old life, our healthy life, and we could check the box on the medical forms that says no past medical history. No, I'm not on any medications. Back when I did surgery with my hands, pedaled my bicycle with my legs, opened the mail without having to rest, could eat popcorn and chew over and over. I wanted to hit rewind and not live with chronic stillness. Because like I said, I was always in constant motion. I treated rest like a 4-letter word. And I'm not saying that's a good thing, but this is something I did even since kindergarten. Do you remember those red and blue foam mats that we used to have to take a nap on in kindergarten? I'm like, what is the point of this? I'd see a kid over there with drool running out of their mouth, and I'm thinking, this is a waste of time. What are you doing? I'm over there with one eye shut, hoping the teacher doesn't get on to me. I never valued rest. I lived life on a merry-go-round. But the problem with a merry-go-round is there are no brakes on it. And if you jump, you'll skin your knees. And everybody who loved me told me I needed to slow down. I just didn't know how. And then that merry-go-round of life and MG just threw me 20 feet in the air and I landed flat on my back for a time of forced rest, where I had to think about everywhere I was going to spend my strength. And I had a very limited strength budget. So Tim Allen, again, in the movie The Santa Claus, starts undergoing the de-santification process. I don't know, I guess maybe they were weaning him off of the prednisone. But he had to find a wife to stay Santa Claus. But he had to leave the North Pole to do it. And when he left the North Pole to do it, his magic would start to just wane away. So Bernard, the chief elf, gave him a meter that he could wear on his wrist that would tell him when his magic was getting low. And I often wondered, can I get one of those? Because I need to know how much magic is left. I want to make sure I don't get out there away from home and get stranded with not enough magic to get back. I needed a strength meter so that I knew that if I went to the store, I could get out of the store. That if I started dinner, I could finish dinner. Because so many times I'd slice a tomato and by the third slice, I'm done. I'm out of magic. We all are. Our strength is limited. And the truth is that everyone is limited in some way or another. The magic simply runs out. But this was my life. Suddenly, I'm no longer on the merry-go-round. I'm sitting in a recliner. And as I sat there and thought about my limitations and thought about the betrayals, I began to let bitterness take a root. And they don't call it a root of bitterness for nothing. Because anything you feed, it grows. And I would let my thoughts spin around in my head like a cotton candy machine, picking up more and more sticky junk every time they swirled around. What I could have said, what I should have said, what I would have said, the rehearsal to some invisible jury that was going to understand that I was right and they were wrong. You know, what you practice makes perfect. So I was so angry and so bitter. And I'm honestly embarrassed to tell you this, and I don't think I've ever told anybody this before. But I got online and I gave that doctor a bad review. I am ashamed to admit that. It was a very childish thing to do. But I had practiced that grudge until I had perfected it. And I thought about what that doctor had done to me. And then one day I was about a year later, I'd been in my recliner for an entire year. And I did something that seemed silly, but I promise I had a reason for doing it. I Googled my name. And someone had left me a bad review. Now, this was a year after I had closed my practice. By this time, I'd had a thymectomy. I'd had about 17 IVIG infusions. I was taking handfuls of pills, these to treat the disease, these to manage the side effects. I had not even practiced medicine in an entire year. And it was a new review, 364 days after I closed my practice. And it said, she was a terrible doctor. She didn't read my chart and didn't know anything about me. Ouch. Now, my life was clearly falling apart by that time. We had a new EMR. I was already on prednisone for ocular myasthenia gravis. I could blame all of those things, but the fact is I failed that patient. But let me tell you something else. I have no idea who she is. I don't know her, and I hadn't thought about her. And for 365 days, she'd been holding on to that moment. And she'd written a bad review. But isn't that exactly what I had done to my neurologist? And I just bet you that she had moved right on to the next patient and she never thought about Vickie again. You see, that's what unforgiveness does to us. When we nurse a grudge, we are poisoning ourselves and creating a prison for ourselves. And I always say, betrayal is a wound inflicted by others, but unforgiveness is a wound that we inflict on ourselves, and it only hurts you. And so whether you've been betrayed or whether you've just lost a lot of things, I'm going to encourage you to do something when you get on the plane today or in your car to go home, whatever. Make a list of everything that myasthenia gravis has taken away from you. Because I'm a believer that you have to go through it and you can't go around it. So I want you to make a list of all of your losses. But I also want you to think about myasthenia gravis as a gift. Now stick with me here. I'm pretty good at buying gifts, but I am lousy at wrapping them. I don't know what the deal is. I take that paper and I measure it every single time. And when I bring the ends together, they never meet. And so I always have to get a scrap of paper and I put it in there and I tape it with these big old hunks of tape that might have some wrinkles in them. And then I fold those little pointy things on the end and they always kind of veer off to the side. It's pitiful, y'all. And I get a bow, if I have one, in the bottom of my closet and slap it on the top. When those wrapping sacks, the sacks that you get, the little gift sacks, when those came out, I thought this is the perfect thing for the wrapping impaired. And you can reuse those things 100 times. Problem is, I reuse the tissue paper and it's 89 cents a package. The other problem is that all of my friends have been to the Southern Ladies School of Gift Wrapping. And they bring these perfectly wrapped gifts, and those sacks look like they have tulips blooming out the top of them. And so I'm always a little self-conscious. I'm kind of even embarrassed to take a gift into a shower. And so if I've got on a jacket, I've got it hidden up under my jacket, or I tuck it under my little purse, or sometimes I just kind of put it up under my thigh and schlep in like this till I can get it in with all the other gifts. Once it's unwrapped, it's a great gift. But the wrapping paper looks terrible. Now, these hands have done a lot of things. I can deliver a baby, I can tie your tubes, I can tie up your bladder, and I can't wrap a gift? What's up with that? Well, I'll tell you, I think that the reason I can't wrap a gift is because I think wrapping paper is just trash. I mean, really, there's two kinds of people in the world. There are those people, you know, those people that pick at the tape and they peel it back like this and they fold it into a nice little neat square and they throw it in the trash can. And then there's people that just rip it off, make a giant paper wad, and they put that in the trash can. And y'all, the difference between the two is 20 seconds. Either way, wrapping paper is just trash. It's just ugly wrapping paper. So I want you to think about myasthenia gravis as wrapping paper. And I want you to start to look for all the gifts inside. And myasthenia gravis has given me so many gifts. It's the unwrapping, the revealing of who you really are. And what I did to that doctor, that was a little bit of a revealing of who I really was. But I began to do some things differently, and this is what helped me to heal. And I want to tell you how. How do you get over a life that will never be the same? I think the number one cure for bitterness is gratitude. It literally changes your brain. It makes your dopamine levels go up, which is the reward hormone. It makes your serotonin levels go up, which is the happy hormone. It makes cortisol levels go down, which is the stress hormone. It literally changes your brain to be grateful. And so what I would do is I would go out to my porch every morning because I was up way before the sun came up because of prednisone, and I would drag myself out there and I would count my blessings. And I did it out loud. And I started at the beginning. I was thankful that I was born healthy because many people are not. I was thankful that I didn't get myasthenia gravis till I was 50 so I could rollerblade and play kickball with my kids because, yeah, I was that mom. There's always something to be thankful for, and it helps you sleep better, and it makes you more resilient, and it improves your relationships with other people. So count your blessings and be grateful. Write them down in a journal. Say them out loud. I spoke them out loud even when there was no one there to hear. But tell others, because if you don't tell others the good things in your life, then myasthenia gravis will threaten to take over your entire identity. Oh, you look like you're doing great. Well, yeah, that's because I'm out and I'm here and I don't know what I'm going to be like in 20 minutes, but thanks. It becomes your entire identity. So speak out loud those things you are grateful for. And I'm going to tell you some things that I'm grateful for. I am so grateful to be here today, and I'm really grateful for MGFA. The resources that they provided, especially early in the disease when I'm like, what is happening to me? And just coming back here and connecting with old MG friends and making new MG friends. I'm so grateful for all of that. And there really weren't any treatments for MG when I was diagnosed. And now you have all these wonderful drugs, and I'm thankful for all these sponsors that are here. But I want to tell you what else. I've met several of you who have caregivers who said, and that more than one person said this to me, I'm just along for the ride. What a wild and crazy ride you're along for. But I want you to just hold up your hand if you're a caregiver that's stuck by your loved one with MG, and let's just give them a round of applause. I don't know what that's like, but it must be really hard because let me tell you, not everybody does it. The second thing I would tell you to do is make sure you change your focus. Did you know that a dime can block out the light of the sun if you hold it right here? And sometimes that's what we do with everything that's happened to us or everything we like. We just hold it right here and stare at it. But if we would take that away and change our focus and look around, we would see that MG has given us a lot of gifts. When I was first diagnosed, I had a colleague, a family practice doctor, who was diagnosed with ALS about the same time that I was diagnosed with MG. And typically speaking, MG starts at the top and goes down and gets better over time. ALS starts at the bottom, goes up, and is universally fatal. And he was diagnosed just shortly before I was, and he looked at me one day and he said, Vickie, I don't think about what I can't do. I think about what I can do. And that stuck with me because if he could say that, and he passed away about 4 years after that, then I can say that. I don't think about what I can't do. I think about what I can do. And one of the greatest gifts that MG gave me was time. I never had time. I was always juggling everything. My daughter was in school and she would call me about 3 o'clock every afternoon and she would say, are you busy? How many of y'all been to the doctor at 3 o'clock in the afternoon? By that time, I'd delivered a couple of babies, had the pharmacy on one line, I had the nurses on the other. Yeah, I'm busy. Suddenly, I had time for the people in my life that I really cared about. I had time to think and read and pray and figure out who I am if I'm not Dr. or Mrs. Myasthenia gravis gave me that gift. The other thing that MG gave me was the desire of my heart. I had always wanted to write. I wanted to be an author. And I think I was about 11 years old when I wrote my first book. And it was called Mr. Mouse and Moj. And Moj was this little creature of some sort. He had a red belly and blue arms. I think I colored it with colored pencils. And he was going to rescue all the forest animals from some impending doom. And so I wrote this little book and I illustrated it and I went down to the public library because that's what you did back then. And I met with the librarian and she looked up a publisher of a children's book and she put it in a little manila envelope and mailed it off. And that was in 1975 and I'm still waiting to hear from him. But I wanted to be an author. And in the 8th grade, I remember we had to write an essay and say, what do you want to be when you grow up? And I was like, I want to be an author. And somewhere along the way, that just started to sound silly, like a little boy that wants to play in the NFL. And I thought, I'll go to medical school instead. Seemed like the obvious choice. When myasthenia gravis ended my career as a doctor, I started writing. And I had a blog, and I called it My Right Side Up Life. because shortly after I got sick, my pastor wrote me a little note and he said, I'm praying for you. I know your life's been turned upside down. And I said, you know what? In a whole lot of ways, my life's been turned right side up. And I was able to write from my recliner home alone and share that with people literally all over the globe. And it was a gift. It was the desire of my heart to write. I finally did write a book. It's called Dressing the Wound. Give yourself the gift of forgiveness. And it was therapeutic for me to help me practice what I knew would get me over that bitterness and unforgiveness and unwrap the gift. So I just want to challenge each and every one of you to find your purpose, redeem this disease, and find the gifts. And that list that you're going to write out, that's just wrapping paper. I want you to throw it in the trash. I don't want you to keep it. I just want you to acknowledge it, because that's not your identity. That just helps reveal who you are. The wrapping paper is the trash, and the gifts are inside. The other thing that I want you to embrace is connection. Aren't you so glad to be here? Has this just been incredible? I have met so many people who are inspiring and resilient, and they feel exactly the same way I do. And I know there are people that have this disease that are home having a pity party. They should come to this conference, because I am in connection with people that I have met strictly through the MG community, and I would not trade that for anything in the world. We have to help each other. We used to say we're stronger together. And I read a story about a storm that came up in Florida one time on the beach, and there were people on the beach enjoying themselves in the sand, and then there were people out in the water. And this storm came up suddenly, and there were all these violent waves, and those undercurrents will just pull you under. And the people that were in the water were literally going to drown. And someone on the beach decided to form a human chain, and they stood on that solid ground far away from the people that are out in the water. And they took the hand of the person next to them, and they took the hand of the person next to him, until one person's out there in the waves reaching out for the one that's drowning. And if you're drowning, would you just turn around and grab the hand of someone that's there for you? And they're holding on to the hand of somebody that's stronger, and they're holding on to the hand of somebody that's stronger, and they're finally holding on to someone that's on solid ground. But they're way down there. And so we each have a place in the lineup to help someone who's just not as far along in their journey as you are. And I know you are, because I've met so many of you and talked to you. Now, I want to tell you a little bit about my life after MG. And I'm pretty sure I would never choose to have myasthenia gravis, but I'm not sure I'd trade it either. I can say that with all honesty, because I have a new life. I have a new name. I have a new husband. I have a new home. I have a new town. I have new friends. I have a new hobby. I even have a new dog. But most importantly, I have a new purpose, and I have a new identity. I'm pretty sure it's better than the one I had before. I'm on my third career now, after my MG started getting better after a couple of years. And the hospital asked me to come back as chief medical officer. So I spent 7 years in the C-suite, and I loved it. But I got remarried about 2.5 years ago and relocated. And I got board certified in lifestyle medicine, which is a subspecialty of conventional medicine that uses nutrition, physical fitness, social connectedness, stress management, minimizing exposure to harmful substances, and restorative sleep to treat, prevent, and reverse disease. And I'm board certified, but I'm not practicing. I'm doing a podcast. And it's so much fun. It's called Healthy Looks Great on You. And I discuss all kinds of different diseases. I developed prednisone-induced diabetes pretty severely. Went away after the prednisone was weaned, fortunately, but unfortunately it started coming back. And I was able to reverse that. using lifestyle medicine. That's how I discovered it. My doctor looked at me and said, "Are you willing to make some radical changes?" I said, "I will do anything to not be diabetic." So I did this. It lowered my cholesterol. It improved my health. I'm not saying lifestyle caused my MG, but it helped manage the other things that came with MG. And it also helped me realize that there's a connection between health and sleep. And I'm not really an expert on sleep, but I am an expert on sleep deprivation. And there's a connection between sleep deprivation and autoimmune diseases. I talk about that on my podcast. You can find me on Spotify or Amazon or Apple or Podbean or wherever you get your podcast, they always say. But I would like to invite you to join me on my journey. Your circumstances reveal who you are, and I would love to hear your MG story and how myasthenia gravis turned your life right side up. You have an MG story, and you get to control the narrative. It's not easy, but you can do it. So you can take out your phone and scan this QR code if you'd like, because I have created a gift for you, just for the people that are here today at this conference. I have a little workshop on the connection between your health, sleep, and autoimmune diseases. And I'll send it to you by email if you subscribe to the podcast and you just want to do this. Or you can just go to healthylooksgreatonyou.com/MG, because this is just for you. There's a little button that says, I have MG. I would love to stay connected with you there, or on Facebook, where I'm Dr. Vickie, Vickie, because I'd love to hear your story. I've heard so many inspiring stories, and that's what it's all about. Thank you very much. Did we do any questions, or were we going to do that? I don't. Okay, good deal. Thank you.
Good morning, everyone. I hope you remember me from yesterday. I'm Michael Antonellis. I'm introducing our next speaker, Jen Horonjeff. She is a PhD. She's the founder and CEO of Savvy Cooperative. She is a lifelong patient advocate, named one of 50 most daring entrepreneurs from Entrepreneur magazine. She champions equity valuing of patients. She focuses on contributing insights to research and product development. She lives with multiple autoimmune diseases. She survived a brain tumor. She is committed to amplifying patient voices everywhere. She's a researcher, a human factors engineer, a former FDA advisor, and she's thinking about the future always, a future where we ask patients to co-design healthcare solutions. Let's everyone welcome Jen. So happy to have her here.
All right. Wow. Thank you so much for having me. Here's my little clicker here. And usually I feel like I say, I don't like following people that just gave amazing presentations, but I'm actually really grateful to follow Dr. Kasper after hearing her incredible story, because I want you to understand the power that you have as patients, as siblings, as parents, as people advocating for MG, that your story matters too. And the reason why I'm up here talking to you today through that introduction, while I do not have MG myself, I also grew up with autoimmune diseases. So before we get into talking about how you can share your story, I thought I'd give you a little bit about mine so you understand my journey to be here and to share with you today. So this is me. I grew up with a form of juvenile idiopathic arthritis. It is an autoimmune disease. I have arthritis in every joint in my body. I have a laundry list of other autoimmune diseases that came since I was diagnosed at 11 months old. So I have grown up in and out of hospitals, trying different treatments, struggling, succeeding, challenges, you name it. So I understand, especially with autoimmune diseases, that this is something that just goes up and down and up and down, and it's oftentimes invisible, but yet we're struggling with that, and that story needs to be shared. And I, unlike you fabulous people in the room, I did not meet another patient with my disease until I was 18 years old. I went my entire childhood feeling alone, feeling like I was the outsider, dealing with the things that my friends couldn't understand. So I just want to take a minute and really applaud you all for being here. I'm getting goosebumps just thinking about this. I wish I had this opportunity when I was a kid. So to all the parents in here that made the decision to be here today, just a special shout out to you for making that commitment for you and your family. A shout out to the siblings that may be here, because I think that's such an important aspect too. And to, of course, the people that are living with this condition, just how we can make a difference together. So this is a little bit about me. I then ended up getting very involved in conferences just like this. And in fact, when I got here yesterday, I was like, I've been here before. This was me and my patient conference at this very same resort in 2016. This is my crew of young adults that I helped lead their conference and to help really empower them to understand that even as teenagers going out into the world, that their story mattered. And something that I notice when we're joining together at these types of events, that when you're talking to others, it's starting to build this muscle of how we can talk and share about our condition and feel empowered to do so. And so just like Dr. Kasper was talking about how her MG diagnosis led her to new careers and new journeys, I'm hoping for some of that for you and your families as well. Because you may not know it now. That's me, that little circle person down in the bottom. I had no idea back in 2016 that I would be up on a stage today telling you that I started a company to help other patients and caregivers share their story. Yet here we are. So you never know where this journey is going to lead. And I share the same sentiment as Dr. Kasper, that I am proud to have grown up with the conditions that I had, that have empowered me and led me to understand that I have a different path in life, and it is unique and it is fabulous. And I'm so grateful to have the opportunity to share that with you today. So as we get into why I'm here to tell you about how much your story matters, let's talk about kind of where we're going to go with this conversation. Maybe. There we go. All right. So today, I'm going to tell you a little bit more about patient engagement. And that term, kind of a funky term, people don't really necessarily know what that means. And some people define it in two different ways. Patient engagement being maybe with your own care team. How are you engaging with them, collaborating on making treatment decisions? A very important part of patient engagement and patient advocacy. I'm going to talk about the other kind of patient engagement today, which is how patients can work together with the industry sponsors that are all here, to be working with academic researchers, to people who are developing new apps to track your medications or make your patient experience with all of your health records better. All of these people will be better, making better innovations with the contributions of patients and caregivers sharing your personal stories. Let me tell you, when I try out a new thing, a new innovation, and it doesn't work, and I'm struggling with it, I go, they did not ask patients. They did not know the realities of the patient experience, and that's why this thing is so clunky. So that is really what we're going to talk about today, is kind of like where things used to be, where they are now, and also where things are going and why your voice really matters at shaping the future of healthcare. All right, so let's talk a little bit about the past. So I talked about 2016. Interestingly enough, that 2016 picture, I was on the verge of starting Savvy with my fantastic co-founder, who's here today too, that back then in 2016, when we started talking about patient engagement and that patients need to be part of the conversation, I got a lot of pushback. I said, nah, we already know, we're doctors. Doctors are the ones that share. They know the patient experience. They'll tell that for them. Anybody agree with that sentiment? Okay, cool, then we're in the same club here. So that's what we would hear. And we even push the boundaries even more at Savvy, saying when patients share and caregivers, they should be compensated for their time and expertise. Whoa, 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 whoa. Now that's going too far, they said. Won't that be coercion if we're paying them to share their experience? Who thinks that that would be true? Do you think that if someone gave you $100 to do an interview, that you would all of a sudden just completely alter your story because somebody gave you compensation? I don't think so. So we really advocated for how can we make this more standard? And I'm happy to report, flash forward, that this is something that is now recognized as needing to be done. But that's where kind of this has really evolved from. You might hear the terms, it certainly is a big term in like the industry. People talk about being patient-centered. And what the heck does that even mean? There's a lot of like little graphics that show like literally like a patient and they put everything like around them. And it's like, there's even, graphics that show almost like a little petting zoo with like a little rope around and everybody can look in at the patient, but they're not actually talking to them. So we're trying to say being patient-centered isn't just caring about the patient. To truly care about the patient, you actually need to talk to the patient and family members that can share that experience. So that's where we've been chipping away at this. And there's been a long history of patient engagement that has helped to get us to where we are. I look to the activists and the advocates that were part of the AIDS and HIV epidemic in the 80s. They really paved the way for patient advocacy. They really would not take no for an answer and worked then with organizations like the FDA, like other academic researchers, to help make sure that patients were being heard. So we have them to thank in that community for that now being part of how research is done. Even the FDA now recognizes patients being part of the decision-making process in different ways. So there's been a journey to get us here, and I'm very grateful for those folks that came before us that now allow us to say, yes, our voices need to be heard, and we want to be fairly brought into the conversations. So where are we today? I can tell you that I've seen a lot of progress. Savvy's been around for 9 years, and in that time, we have seen more and more companies seeing that patient engagement is no longer a nice to have, but it's something that is just part of the process. So we work with things like pharmaceutical companies, digital health companies, hospital systems, payers, to help them understand the patient experience. Even just about 2 weeks ago or so, I had a patient experience that I shared out that just shows that while we have a lot of folks that care about this now, we're not quite there. I'll share my experience with you. I do not live in Austin, Texas, but I found myself in Texas the other day or the other week for an event. So different state, I live in New York. And I got a call from my doctor while I was there saying my labs just came back and I needed a medication immediately. Oh, okay. How do I get that? Can I, go to my regular pharmacy? No, this is a specialty drug. So we're going to need to get that to you a different way. Well, long story short, I did not know how to find this medication in a different state. I was trying to then go to the ER where they could give it to me, but yet I did not have access to my medical records, so I couldn't even do that. So it was phone calls with all these different folks running around, leaving the event I was at, trying to find this medication. And I'll tell you, nobody thinks about this process of how hard it can be to get your medical care. They say, who's ever heard this term? You're non-compliant. You're not adhering to your treatment plan. Anybody ever been told that? Yeah, right? You're like, are you kidding me? Of course I want to be able to take care of myself, but sometimes it feels like it's so hard. Those are the exact stories that people need to hear in order to create a more patient-friendly process to take care of ourselves. And so that's why we need to be sharing these stories. So some examples of how different companies have engaged with patients and made real change. One example, Amazon. Amazon came to us and said, we want to make our Alexa devices, the ones that you speak to, more patient-friendly and accessible to people who have different speech patterns. Because they were not working in people who had stutters and stammers. They just wouldn't recognize it. And so they were able to come to us, and we were then working with them to connect with people who had different speech patterns, who trained these devices how to now understand people with different speech patterns. Success. And now that is deployed as a patch that they have as a new feature within the Alexa devices a couple years back. But what a success story of being able to work with patients. How many people have maybe even considered a clinical trial in this room? Yeah, so that's how innovation happens, clinical trials. But do you ever think about participating in a clinical trial and you go, oh gosh, they're asking me to come in every week. I have to fill out these surveys all the time. I don't know if I want to do that. Well, we work with companies all the time, like those pharmaceutical companies that run the clinical trials, to have patients review those protocols, what patients are asked to do, to see if they're friendly enough for patients to actually enroll in. And also maybe what else? We were working with a company recently that they were like, we want to provide a kind of a care package to patients and families to make their experience better. But we want to hear from patients what they want to go into that. What a great innovation to be able to provide that. How about those apps that you also get that you're like, this doesn't make any sense. I can't connect my health records into it. Remember during the pandemic when everything went virtual and we just threw a bunch of technology at patients and said, good luck? Yeah, and there was a good reason at the time that we had to move very quickly, but it wasn't done in a way that really helped amplify what patients were going through. I remember I had to use all this technology and I was like, wait, these don't integrate with my different systems. You didn't ask me. So that's not very helpful. I'll share another personal experience of mine. So living with autoimmune diseases, I have been a long time taker of those biologic medications. And they can come in different formats. Some are infusions, some are injections. And with the injectable kind, there was one medication that I was on that it just had a sort of a fancy design to it. It's a little bit different shaped. So I had that medication. The sharps container they provided me to take or to dispose of the needles, the syringes, was too small to fit these fancy new design syringes. So I would have to take all of my syringes, my injectors, in a Ziploc bag and take it to my rheumatologist to dispose of them. It's not safe, don't do that. But that is how it happens if we don't actually understand the patient experience and kind of understand what do you do after you take your injection? It's a very simple question, but if we didn't ask, you end up with a Ziploc of sharps. So more examples of why we need to hear these stories. And so that's really what we're here to try to empower you all to understand, that you may be on a different part of your journey with MG, understanding how does sharing my story matter, but it is in these nitty-gritty little stories that people learn so much. You have people like me that are advocates now, that are sharing at all different levels. But I don't want you to feel like you can't share, because it's truly the voices at all different types of experiences, whether you were just diagnosed, that is so valuable to understand what are you going through, as well as somebody that's been diagnosed for so many years to say, how have things changed over time? So each one of you has such a powerful story, just sharing those day-to-day experiences to be able to share with industry who are trying to go out there and help make new drugs and new treatments for you, but they can't do it alone. One of the things that I think is so important about this work is understanding what matters most to you. So I'll tell you, prior to starting Savvy, I was actually an academic researcher. I worked at Columbia University and I was studying what matters to patients. And incidentally, because I come from a pediatric illness, I was very interested in what do patients think, what do parents think, and what do providers think. Guess what? 3 different priorities. No surprise there, right? So that's why we can't rely on just the doctors. We need to incorporate both the caregiver and the patient perspective to understand. I'll share from the rheumatology community. Oftentimes, which is very common in autoimmune diseases in general, fatigue is one of the biggest challenges to face. Does that resonate with anybody? Yeah. So exhausted. Do you know fatigue didn't used to be measured, especially in clinical trials for arthritis medications? Finally, it now is, but it took a lot of research and proving, no, patients really do care about fatigue. They were just measuring pain, mobility. But I just want to get out of bed, feel like I can actually do something today. So to be able to understand that, now we actually measure for it. So this is something that as more and more people enter into the space, especially in MG, I know that there's so many companies that are now entering in that already have medications in the field for you all, and there's more coming. Of course, no promises here. I'm not one of those researchers, but there's so many more that are investigating this area. So thinking about that, it's even more important for you to share your stories right now because there are folks out there working hard to provide new treatments, and they need to know what matters most to you. And so that's where you say, it's fatigue. It's not having to miss so much work to, go to do my treatments. It's actually being able to X, Y, or Z, pick up a grandchild, whatever it may be. All of this is so important for you to be able to share. So how do we actually do that? There's a lot of different ways that we can think about sort of what we can do going forward when it comes to patient engagement. There's a lot of ways that you can share in the comfort of your own home. And that's what, of course, after the pandemic, a lot of things turned virtual and technology can be there to help you share your story. And it's becoming even more important. I don't know, I wasn't here for all the sessions yesterday, but did anybody mention AI? Not yet? Oh my gosh, okay. So this is something that I feel like every conference now, like everybody's talking about AI. What does AI need in order to produce results? Anybody play around with ChatGPT or anything like that? Okay, yeah, I know, it's still new. But the reason it can return results is because it needs data. And this is what a lot of folks are doing now, is trying to understand how can they get information to people faster, be it to patients, be it to researchers, other people creating new innovations, faster. But we need more information. And what we at Savvy care about is we need information from people who actually have the condition or our family member living with that condition. So we absolutely need to understand that perspective. So that's why this is going to become even more important to understand how you can contribute. And so there's lots of different ways that you can share your story. This is what we do at Savvy, but of course there's other places that you can share. Obviously with MGFA, I'm sure there's lots of opportunities where they're asking you for your perspective as well. So I hope that this also helps you understand that when you're being asked to contribute, there are real, meaningful, and tangible results that will happen from you sharing your story. This is not just, oh, it's like, ask patients and make them feel good, give them an opportunity to share. You really want to understand your feelings so that you can actually make this stuff go forward faster. And I'll just give you some examples of the types of things that we do. Of course, other organizations can help support this as well, but we do things like surveys. We do a lot of interviews, so it could be over, Zoom, to be able to talk through what's your experience. Might be showing you some prototypes of some new apps that are being developed or new ways that you could be able to contribute. We also have like forums and online ways to just log in, share your experience. And so that's why we want to make this more and more accessible for more patients and families to be able to contribute and share their experiences. So really, really important that you feel empowered to do that. Now let's talk about some of the logistics. You shouldn't just have to share and not know where your information's going. You shouldn't have to share and just do it out of the goodness of your heart, which I'm sure you do, but that's something that we have spent years advocating for people to understand, that you all have a right to also be fairly valued when you're doing this kind of work. And so you're oftentimes asked to sign a consent form. What's a consent form? You should always read the consent forms. You do it when you go to a doctor's office and you're signing, the various forms, or your HIPAA privacy practices, or anything else. The terms of service, if you're using Apple or Android, you scroll through, you click at the bottom. But it's really important to read these terms to understand what you're being asked to do and where your information is going. But you should be looking for a couple things. How is my information going to be used? At Savvy, we really make sure that it's really for what's known as like internal purposes, just to help a company or a researcher understand the patient perspective. If it says something like, you're releasing your likeness for royalty-free, worldwide use, that means they can do kind of whatever they want with your data. And so you might not be so happy about that per se. And if you are, that's totally fine. But just to sort of share, there's different ways in which people may use patient information. So to be able to read those consent forms so you know And you can ask them also to explain it. No, we don't all have to go to law school to have to understand how to read a legal document. So please know that you can ask questions. Okay, so now you've signed your consent form for, whatever that may be, and you're going to be asked to do something like a survey or an interview. Well, that takes time, right? You guys have busy lives. You got things to do. And so that's what is known as compensation at fair market value. You can get paid to share your insights. And that fair market value can depend a little bit on who you're working with, but roughly speaking, it may be in the $75 to $125 an hour. And within that, it gives you an opportunity to be able to be fairly valued for your time, because we know that patients and caregivers are oftentimes juggling a lot of things. Maybe, you're at work and you need to take that call, or you need to get a babysitter so that you can be able to take that call. So all of these things matter, and that's why that value exchange is so important, and that you all should know that your insights have value. And so as you share, think about that. There's other ways to be valued too, and that's in terms of, maybe as you're sharing this information, what kind of information are you getting back? Anybody ever participated in a research study before? Yeah, some folks in here. Do you ever hear what happened to that research study? I hear some yes, fantastic, some no's. Yeah, what a bummer when you contribute, you share, be it a survey, be it maybe doing some extra lab draws or participating in a full clinical trial. And then you go, what happened? That's a bummer. So hopefully more and more companies too and researchers are understanding, how can we return that information back? How can we share the results? Because oftentimes that's what patients are really interested in, just understanding how they may also compare to other people living with the condition. So all of these things are what we would consider value exchange, but it's so important that patients are empowered to know that when you are participating in anything, to understand the results is a form of valuing your time and your expertise. And that's something that I've learned as a patient myself, is that it's just nothing compares to that feeling when you know that you've contributed. So I want you all to have that opportunity too. And that's something that hopefully even just being in this room together over the past few days gives you that opportunity, gives you that sort of, enthusiasm when you're meeting and sharing just with other people here at the meeting, that you have that value exchange. It's magical. And I hope that you are able to leave here and find more ways to do that, just beyond being able to share here, share with others, take this back to your communities and share. Because I'll tell you too, as I start to close out my time, sharing with other patients and family members has just been absolutely life-changing. For me on so many levels. I told you, I didn't meet another person that lived with my condition until I was 18 years old. And it just absolutely changed the trajectory of my life. I then wanted to do more. I wanted to share. I started leading other types of, volunteer organizations similar to MGFA, and helping to organize different sort of committees and events for them. It then gave me the opportunity to connect with other researchers, and I started to learn what research is and what they did. And just it went from there, from one thing to the next, to ultimately starting a company that really empowers people to share their stories. So I don't know where everybody's journey here is going to take you, but I just want you to be excited about the potential, just like what Dr. Kasper was sharing beforehand, that you may not see what's lies ahead of you now, but I just gotta emphasize that if you lean into understanding that this is part of a really exciting opportunity to share, I just know you're gonna unlock so much more. And so I know that that's sharing from my personal experience, but it's what I hope that you're able to take away today as you're able to kind of close out your time together, to be able to remember that sharing even amongst each other is just one part, and then there's other opportunities out there and people want to hear from you. That's why events like this have sponsors, because they care so much about providing patients with the opportunity to share their voice. So as I close out here, maybe can take another question or two. I thought I'd throw in a picture from me and one of my arthritis friends from Rustler's Roost. And folks go there last night and have a good time. Okay, so that's what, 9 years ago, but there's me. Was that same Thanks. Anybody get a picture just like this last night? No? Okay. Whew, well, then it's an antique. But I just want you to know that like these are such meaningful connections that you're also making. This is a friend of mine, Jen, the other person in this picture. She and I met during that very first volunteer opportunity that I had when I was 18 years old, and we've been friends ever since. Won't show you how old I am, but it's been a long time. And just the connections that you make are unlike anything else that you have. So this is just an amazing opportunity. I applaud you for being here, for taking the time to come and meet. Just so special. And as somebody that didn't have this opportunity, just to reiterate again, that it's so special that you're here and making this commitment.
Well, thank you for coming back inside. I know it's beautiful outside, but we've got a couple more great presentations to go through at the conference. I'm here to introduce our next presenter, Dr. Sarah Wright. Dr. Wright's a pediatric neuromuscular physician at the Children's National Hospital in Washington, D.C. Dr. Wright has a background in both research and clinical practice and is focused on understanding how certain environmental factors and blood protein levels might affect the health and recovery of children and young adults with autoimmune myasthenia gravis. Dr. Wright is also a partner in MG Care and a member of this year's National Patient Conference Steering Committee. Let's all give please give a warm welcome to Dr. Wright.
Thank you. Good morning, everyone. Can you hear me in the back okay? Great. So you may wonder why a pediatric neurologist is standing before you today, and that's a great question. But I will say neuromuscular medicine, and the reason why I was drawn to this field is that it is a lifelong study. And so part of my training is working with adults. I see young adults, and it's something that all of these particular conditions can range across the lifespan. And so it really is my honor to be here in front of you today and to be a part of this conference and to hear your stories, to hear how you came to this tumultuous road of getting a diagnosis and how you've been living to manage your symptoms of the disease. And I will say that part of my overall journey with neuromuscular medicine, when I finally came into my own practice as an attending and started seeing children more regularly with myasthenia gravis, one of the things that saddened me is that many of them I inherited who had been on steroids for many, many years. Their growth was faltered, they had chronic complications from the steroids, and they still had really severe eye weakness. And I thought to myself, we can do better and we need to do better. And I've actually been on the other side of the room as an autoimmune patient with chronic inflammatory bowel disease. And I remember that tumultuous journey and these chronic bouts of steroids. And I said, I can't do this to my kids. And so what I would like to impart with you today is, I'm not doing that, by the way, impart with you today is that exercise is a really critical question that we get in our practice. And so I have the joy of seeing young adults become, even more responsible for their care. And so their transitions from high school to college, to being on the college volleyball team, to living with their MG and figuring out how can they safely exercise. And this was a question that I posed, to myself to make sure that I can help them improve their lifestyle and improve the day-to-day symptoms of their disease. And so if you feel comfortable, quick show of hands, I'm going to ask here in the room, how many of you have talked to your physician or asked your physician about exercise and if it's safe for you? Wonderful. And so I want all those people who raised your hands to now raise your hand again if you felt like the physician had knowledge about what to tell you. Okay, good. And how many of you have actually been able to work with a physiotherapist or a PT to help kind of with some symptoms of your disease? Even fewer. Great, that's what I thought. So my objectives for you today is that I want to kind of review some of the baseline mechanisms that lead to weakness and fatigability in MG. We've been beautifully set up with this by talks from Dr. O'Connor yesterday. I want to discuss, the current treatment landscape that we have and how we can kind of symptomatically help weakness and fatigue. But really where we're going to spend the bulk of our time this morning is discussing the current literature on exercise and MG and hopefully convincing you that you can work towards a regimen that may be safe and effective for you. And then talking a little bit about what questions should I be asking as a patient for my physician? What should I be advocating for? We've had some wonderful discussions on advocacy this morning, and your voice is the strongest voice in the room. And so I want to empower you to go back to your physician and have these conversations. And I think one of the beautiful things that we have seen from the last 2 days is that myasthenia gravis in general is a budding field. There's so many new treatments. And our hope is to be in a place where eventually we have no myasthenia gravis. But until we get to that point, we have to have tailored treatments for each person. And those treatments may help with the symptoms of the disease, but they may not treat all the facets of the disease. Coming from the world of pediatric neuromuscular medicine, we work with the ultra rare, and we're also in this time that we have so many treatments for previously fatal genetic disorders, but we're starting to learn, even though we may be curing part of it or helping part of it, there's other aspects to human. And so really, I want to empower you to kind of look at these other aspects and see how we can help. And so this is something that Dr. O'Connor went through beautifully yesterday. We don't have to rehash everything, but talking about really actually what causes fatigue and myasthenia gravis and how it's multifaceted is important. And so obviously we have our nerve terminal talking to the neuromuscular junction. And as Dr. O'Connor put there yesterday, you have that mail that can't be delivered. And so it's blocked at the actual acetylcholine receptor. And so that blocking is really the actual thing that when we test for myasthenia gravis with some of those tests that many of you have unfortunately had to go through with repetitive nerve stimulation, that's what actually causes that weakness. And as you've experienced, when you exercise the muscle over and over again, that weakness gets worse, right? And so we have to kind of talk about that and figure out how we can treat that, but also other aspects of that can cause fatigue and myasthenia. And so as we may experience, this is one of the reasons why ocular symptoms may be the first presenting symptom or the most prevalent symptom. And for many of my children with myasthenia gravis, they may have ocular symptoms for many years. And so the reason that the ocular muscles are affected is that there are some muscles throughout our body that are really important and integral to fine movements, right? Your eye muscles are constantly moving, constantly looking around the room. Your wrists and your fingers are constantly moving. And so it's these muscles that are really dependent on some of these really quick movements that have a high number of neuromuscular junction. Those are the ones that can really become weak. But one of the things that's really interesting is that we talked a little bit about what's happening at the neuromuscular junction, but there's actually different things going on inside the muscle in the cellular level and centrally that can be impacting fatigue. So we talked about how in acetylcholine receptor positive myasthenia gravis, there's that peripheral blocking of the receptors by antibodies. And then how here in the yellow, when you have that for acetylcholine receptor positive, those antibodies can cross-link, they can go down into the muscle, they can cause complement-mediated activation and destruction of the muscle membrane. And actually, there can be secondary downstream effects. And in MuSK myasthenia, it's been shown even if you're not getting that degree of complement damage at the muscle membrane, you actually are also getting changes similarly on the mitochondrial level. So if everyone remembers their high school bio class, the mitochondria are what builds the powerhouse in our cells. But then there's central components. And so this is a really interesting thing that we're starting to learn more about in myasthenia, and really is the important thing for advocating, for asking the patient, and really understanding what's going on. And so it's not just what's happening at the neuromuscular junction, because it's been shown that patients with ocular myasthenia gravis also experience fatigue and difficulty with exercise and exercise, fatigability. And then when they've looked at studies where they've restricted physical activity, it seems that that restriction of physical activity made those patients seem more fatigued. So what's going on in the central aspect, and how can we help all of these facets to really understand how we can improve our ability to do some activity and physical exercise? And so this is something that's familiar to many of you in the room. You've been on many of these different treatments, possibly throughout the course of your disease. And so, of course, our current approach to treatment is both symptomatic and then actually trying to meet the immune system and try to help that. And of course, that's different from acetylcholine receptor and MuSK and seronegative. But then there's the psychosocial management. And this is the area where our support groups for MG through the MGFA really help patients, but we as physicians are falling short. We don't talk about the other aspects of the disease. We're not constantly reviewing what is the fatigability outside of the muscle weakness and how is that impacting your life. And then there's exercise management. And so this is where things get a little bit dicey, right? So exercise can be helpful and recommended, and it's been shown to reduce fatigue, but what's the one thing that we said at the beginning? Repetitive exercise to the muscle makes it weaker. So it could be potentially harmful during active inflammation. So how do we reach that balance? How do we work together as a physician, as a patient, as a physiotherapist to really create a regimen that's going to be effective? And so what I'm going to spend the rest of our time discussing is some of the information that has been allowed to change our viewpoint a little bit on exercise and what's the best balance of exercise. Talking a little bit about pharmacologic treatments that may target mechanisms that we haven't talked about in this conference yet, which is a really exciting area because, again, I think we need to treat multiple different facets of a disease. And then again, looking at kind of what may be a regimen and some questions to ask your physician when you're thinking about doing exercise. And so we do clinical research, right? There's basic science research, and then there's research that many of you have been participating in, either observational studies or interventional trials. And so there has been work done both in basic research with mice who are not humans, okay, but also humans looking at exercise and MG. And so I wanted to bring this up because I think that although this may be a little bit complicated, there's been some studies that looked at mice with myasthenia gravis, which is interesting to think about. But they were able to show that exercise may help with neuromuscular junction remodeling and also modulate the immune system. So they took a group of mice who were in middle age, who had not been exercising, and what they found in those mice that didn't exercise is that they had a loss of the area of the acetylcholine receptors in their muscles. And that in turn actually caused dying off of the nerve terminals or loss of synaptophysin. And so this happens naturally in all of us as we age. Our muscle cells get smaller, nerve endings die off, and this is something that is happening in a model of myasthenia gravis. But when they had those mice start working out on their little wheels, they actually found that they were able to recover some of this. And they also found something interesting, that the muscles released something called myokines. So we talked a little bit about those complement levels yesterday. There's other things floating around in our immune system called cytokines. And these are myokines, which are very similar. And they actually showed that this actually has a favorable effect for the immune system, decreasing some of the immunomodulation at the neuromuscular junction. We all have heard endorphins before. You know, some people will talk to athletes who get that endorphin high, right? And so they did look at a group of patients with myasthenia gravis who walked daily for 30 minutes. And out of those patients, 50% of them had an improvement in their quality of life, 15 scores from baseline. And they also saw that their beta endorphins increased after 1 month time. They also seemed to have some improvement in different scales and their number of steps they could do, increased distance on what we call a 6-minute walk test, so how far you can walk in 6 minutes. Again, your activities of daily living, and decreased depression score. Now, this was a very interesting study, and I think is really something that's important to highlight, because even without physical exercise walking, we have seen that in studies where you actually look at respiratory function, right? Everything supporting our lungs is muscle. All of the muscles in between our ribs, our diaphragm is muscle. And so they actually were able to take 80 patients, and 40 of them exercised before a thymectomy procedure and received aerobic training. 40 of them did not. And so what the patients did who were in the exercise group is they both did exercise on a treadmill, so manual exercise, as well as respiratory training. So those little things, if you've ever had surgery, for many of those who had thymectomy, can be very annoying, very painful, but they tell you, get as many balls up as you can, right? And so they did that for 3 sessions a day, 15 minutes per session for 5 days. And one of the exciting things that this group showed that actually received the exercise is after that they'd had their thymectomy, they had improvements in their respiratory function. They had improvements in their activities of daily living score, and this compared to the control group. And then the one thing that I didn't list out here is that they actually had a decrease in the length of their hospital stay from 5 to 3 days. They had decreased risk of having to go to an intensive care unit. Now, both of the groups, unfortunately, did have decline in their total amount of time or distance they could walk in 6 minutes. But I think what this study shows is that even with the respiratory interventions, you may improve your outcomes. But not all science is perfect,
right? And so I wanted to show a study that didn't have any significant outcomes because I think that it's important for us to talk about this balance and the limitations of science, particularly in areas where things like exercise can be hard to quantify and can have many confounding factors. And so this was actually what we would call in medicine and science the gold standard. So it was a randomized controlled trial. Essentially, 45 people were assigned to exercise and the others in that group, so half of them were assigned to usual care. And so the people in the exercise group were supposed to work out 3 weekly 40-minute sessions of an unsupervised, moderate intensity home rowing program. I don't know if anyone has done a rowing machine. Anyone done a rowing machine before? You really have to like rowing in order to continue to doing rowing. I have friends from college who are on the rowing team who woke up at 4:30 every morning. That was not for me. And so these patients, unfortunately, in the intervention group did not complete really a large amount of their exercise sessions. And I think that is self-explanatory in looking at their primary outcome where they didn't have any improvements in the quality of life scales. But again, we have to take this with the understanding that this is essentially a negative result or a negative trial. That being said, when you look at the evidence, it's overwhelmingly in favor of exercise. And so there was a group that looked at essentially all of the studies that had assessed exercise in myasthenia gravis in 2021. This is a great article in Neuromuscular Disorders Journal. And they were able to kind of summarize what was found in each of the studies. And so I won't go through all of these in significant detail, but essentially studies with exercise can be very limited, right? You have a small group, you have multiple different factors that play into fatigue and exercise fatigability, and you have multiple ways of testing it, multiple different regimens. But essentially what most of these studies found was that the patients who participated would have increase in their maximal force of contraction when they worked out one leg and not the other. They also saw that there were some improvements in muscle strength with even aerobic testing or light resistance training, functional capacity, reduced fatigue. Another study also saw that there was some improvement actually in the visual markers of the muscle, so improvements in the thickness when they looked at muscle ultrasound, and improvements in some aerobic activity. Another scale that looked at decrease, again, fatigability after a muscle endurance regimen that persisted for 4 weeks post-intervention. And I think this one trial on the bottom, it's important to point out that this group of patients, this 10 patients did a 10-week physical and psychosocial program. So kind of both facets of fatigue and exercise fatigability that demonstrated a small improvement in fatigue, but that effect was lost after 3 months of the study ending. So what I want to highlight as a summary from the findings of the medical literature is that aerobic activity and resistance training can be safe in myasthenia gravis. Resistance training regimens can be a wide range of things. I think when we think about resistance training, we always think about eccentric exercise and really doing heavy weights, repetitive weights, but that's not the case. Even isometric exercise can be very helpful for building muscle and building that nerve to muscle connection and improving bone health. And so that may better improve muscle strength and functional capacity. We saw that exercise regimens, both pre and post-surgery, including respiratory or breathing exercises, may reduce hospital stays and ICU admissions, which I think is really critical when we talk about someone's overall health and morbidity. And then the one thing that's important to think about is we talk about habit forming, right? They always say that it takes about 90 days to form a habit. The same is true as exercise, right? And so the effects from these training programs can be unfortunately very short-lived. And so about 1 month post from some of these studies that I showed you a little bit earlier. And so when we talk about, forming a habit and forming a regimen, it may be that continuous exercise seems to be crucial for long-term improvement. That being said, we know that there are ebbs and flows to the disease, right? So myasthenia gravis can flare. And so it's important when we think about this, that during those times of active inflammation, how do we maintain a small level or low level of activity without obviously taxing yourself even more? When we look at how we can, talk to physiotherapists, unfortunately, it doesn't seem that there's any evidence right now to currently support a specific training program tailored for patients with myasthenia gravis. So it's a little bit of a choose your own adventure, figuring out what works for you, what things you enjoy, what things you feel up to doing that day. And then again, what we talked about before, one of the largest limitations is that studies only included patients with mild to moderate disease. And so for patients with severe disease or other comorbidities, we need to have a tailored approach. Now, this is something that I think was really exciting for the scientific community and was presented at the MGFA Scientific Conference this past year at the what we call the ANIM conference or Neuromuscular Conference in Savannah. And so this was a pharmaceutical company that is essentially looking at how do we modulate fatigue at the muscle. And so we've talked about treatments yesterday in detail for myasthenia gravis on how we modulate the immune system. But what do we do to help kind of increase that muscle's capability to contract stronger? And so what this group has done is that they've looked in a mouse model and then later on in patients, and they've found that there's actually a chloride channel. So this is called a CLC1. It's a skeletal muscle specific chloride channel. What this does normally at baseline in our bodies is it helps to kind of regulate this chatting between the nerve ending and the muscle junction itself. So it regulates neuromuscular transmission and fiber excitability during very intense exercise. And so what they're able to find is that if they could block this, if they could inhibit this with an oral drug, so it's an oral small molecule, they could actually restore some of that muscle function. And so what I'm showing here on the right is obviously not from human subjects. They did this actually in mice, which is interesting that we can do all these interesting studies in mice. But I'll draw your attention really down to the bottom of the screen. I don't know if this has a pointer or not, but the very bottom, there's these really big loopy lines like this. And so this is actually what we call a muscle action potential. So if we stimulate your nerve and it talks to the muscle, we essentially need to get enough message through, and then you see this kind of interesting response when we do these studies, and you see this really big curve, and that's all of their muscle fibers coming together to make force. And so what we see on the bottom of the screen here is that force. And so on the far left, you have the healthy rat who's, you're stimulating the muscle, and they have a really nice force of contraction. And then you see the rat with myasthenia gravis. And you see that fatigability, right? So you see that repetitive stimulation doesn't end up with that nice muscle force. And what they showed, even without other treatments for myasthenia gravis in these rats, is that they were able to improve the contractility of that muscle using this molecule. They then went on to study it in 12 different patients. And they also noted in those patients who were, of course, on standard of care therapy for their myasthenia gravis, as determined by the trial, that there was a favorable side effect profile, and they also had improvements in their overall QMG score. So again, when I talk about rare disease and ultra rare disease, we have an exciting time of new treatments that are continuously changing and the landscape of how we treat disease, and we always hope for a cure. But until we get to that point, we have to think about all the facets of the disease. And it may be that some treatments can use an adjunctive therapy approach to really helping our symptoms. And so I want to spend some time to talk about what this may look like. So when we talk about creating an exercise regimen, this is different for everyone. When you look at different organizations who talk about the standard of, aerobic activity that we should be getting in a week, it says it should be about 150 minutes of aerobic activity in 7 days, which is 20 minutes a day. I think most of us can say, we could devote 20 minutes a day to something. Whether it be we cut down our morning coffee a little bit, our reading of the news, for some of us scrolling through Facebook, all of these things are important. But we may be able to find some time to carve this out. And so I think some of the core tenets I would like to leave you with are things that may pose more questions. But of course, every person is unique, right? We know those zebra stripes. Everyone has a unique story. So I think it's really important for you to advocate when you go to your physician and say, I would like to start working out. I think it's safe and effective. These are the things I enjoy. So what can I do? All right. So you need to plan this in conjunction with your physician. And if you're seeing a physiotherapist or have been referred to a PT before in the past, this might be a good regimen to build with them, something that you can carry over after seeing them for a few sessions. It's always good to start slow and build, right? So we always would say that we don't want to overly tax the muscle. So I'm always an advocate for my young adults when they want to go back into the gym after they're feeling a little bit better after those first few tumultuous months of living with myasthenia gravis, that they start low and go slow. So I sit down and I talk with them. I know you really want to get back to lifting weights. We're not there yet. What I want you to do is pick what your max weight would have been and take that down by like 70%. And then we're going to start at that weight, and you're going to do a couple reps. You're going to do it a couple times, and then that's it for that muscle group. And so we sit down and we talk about what that weight looked like. For those patients who are doing more aerobic activity, we talk about listening to their body, which is a thing that I feel like most of adults finally get in tune with. And of course, when you've been living with myasthenia gravis, you get to understand what your MG symptoms are and what your kind of signal is that you've overworked yourself. That's a hard thing sometimes for adolescents to learn. And so we talk about this a lot. How do we listen to our body? So I have some young athletes who are volleyball players. We talk about returning to practice for 15 to 20 minutes per practice, and then working their way back up till they feel that you can play in a game. And even if they can't play a full game, to really enjoy the sport that they love, to be able to get in and work that time for their actual activity. And we write letters for their coaches and for their team. Avoiding exercise during disease exacerbation. Again, we know that we don't want to make you feel worse. We want this to be a part of your whole MG care that makes you feel better. And so, that may be different for some people, depending on the degree of your symptoms during your exacerbation. It may mean that you're just sitting, like Dr. Vickie said, in a recliner for some time. That's okay. You'll get back to your exercise regimen when you're feeling better. It may mean that your symptoms are, moderate, and you still feel like going for a 5-minute walk as opposed to a 20-minute walk. So getting to be to that point where you're going to have some flexibility when your disease flares. And same thing that we just kind of chatted about, avoiding overexertion for yourself, listening to yourself. And I think one of the things that's really important is that we talk about what is the standard, right, for aerobic activity, that you need to get around 20 minutes a day in order for your heart health and your lung health. Sure, that's all in great, but even small amounts of exercise and movement can be beneficial. So I talked to some of my patients who are kind of struggling with the way that they can get back and be active. And we talk about things that they like. If they like dance, if they've liked gymnastics in the past, and what are some alternatives that we can help them feel like they're staying moving and getting their body moving a little bit, which is not overexerting them. And so we talk about things like yoga, Tai Chi, Pilates, or even light dance. And so this is just an example that I laid out here for you, what that may look like, right? So you may have one day where you're doing just kind of a rest walk. Maybe the next day you're doing a little bit of light weights for your arms. The next day, resting, walking again. Maybe the third, fourth day, you're doing a little bit of, home exercise, bike. The day after that, take a rest if you need it, walk a little bit. And then the following day, working out another group of muscles, and then kind of repeating the cycle. And again, this is going to look different for everyone, and it should be kind of something that you are working together with your physician to kind of create. But this is kind of the tenets of what we would talk about. And so what are these questions that you should be asking? And so I think this is probably one of the most important things with being an advocate. And unfortunately, in the world of medicine, as you all have experienced, physicians are constantly having to run through patients during the day. I'm lucky as a pediatric neuromuscular specialist that I get 30 minutes for follow-ups, which ends up being about 20 to 15 minutes with the patient by the time they get through into DC and they get roomed. But that time is even shorter for adult neuromuscular providers or adult neurologists. And it's really a shame that that's the way that our healthcare economy has shaped up. But I would say that if you are able to say to your physician at the beginning, one of my goals for this visit is to talk about safe and effective exercise. I know that you need to talk about my Mestinon. I know you need to talk about my immunotherapy. But if it's okay with you, I wrote down some questions, and I would expect for us to talk about it at our next visit. Or if you feel better, just send me a message through the portal, whatever works for you, but advocate for this conversation. And if they say, you know what, I don't feel comfortable, hopefully you can refer them to the MGFA. Or number two, say, okay, well, how about, do you know any physical therapists that I may work with? And again, part of this is going to be advocating for that physical therapist to understand what your disease may be. I think there's been some great sessions here for some physical therapists. Shout out to Priscilla, who brought her physical therapist to give some conversations around what physical therapy may look like when you have myasthenia gravis. But even setting up a few sessions with a physical therapist may get you started on that journey. And so some of the questions that you can ask is, how would you classify the severity of myasthenia gravis, right? And so we know that there's the MGFA scale ranging from 1 to 5. Everyone in this room may have been at some point at a 3 or 4. Hopefully you're more at a 2 right now. But again, what would you say? Am I mild? Am I moderate? Am I severe? Or do you feel like I'm in remission, right? Am I in clinically symptomatic remission or minimally symptomatic expression at this point? After you've evaluated me today, based on my current strength, is there a maximum amount of weight that you'd recommend that I do? Should that be 5 pounds? What should my ultimate goal be? 10, 15? Ask, are there any exercise or training programs that I should avoid? I know things that we talk about in my young adults who are finally starting to feel better is that rarely, but sometimes they want to get back to this extreme form of workout, which I can never advise because I never can know if that's going to tip them over, right? So we talk about going slow and listening to your body, but things like high intensity interval training and CrossFit, I say, you know what, we're going to avoid that. We're not doing CrossFit. So those are some of the things that you should really be avoiding. Ask them, what are some signs that my muscles are overworked, right? As a patient, you're going to know what these symptoms are. You are going to be the best to know, but asking your physician, what are some warning signs? What are some things that I should look out for? I think one of the important things is talking to them about any planned surgeries or procedures, right? So we know that from the standpoint of going to thymectomy, having your care optimized is one of the best predictors of outcomes. And so for most of my young adults, that means that I'm not going to thymectomy with them until they're a year into their disease and we have their disease under control, because it usually takes me about 3 to 6 months of these tumultuous back and forth of the relapsing remitting course to get them better under control. But talking to them, if you have planned procedures, in addition to having my disease under control from an immunotherapy standpoint, what are some exercises that I can be doing to help prepare myself? What are some respiratory exercises? Again, doing a spirometry at home or that you puff those balls out, it's a very, very easy thing that you could do a couple times a day for a few weeks before your surgery and may have beneficial outcomes. So if you're willing to put in the time, talk about that with your physician. If you feel like that you have other comorbidities, or you really do feel that a lot of your symptoms have been bulbar in nature, or you've had respiratory distress in the past, ask them, can I go see a pulmonologist? Has anyone seen a pulmonologist in the room? Yeah. So I've had, unfortunately, a few young adults who've also needed what we call non-invasive ventilation, right? And so although this is a little bit less common in adolescents, thankfully, than it can be in adults. Having a physician who is a pulmonologist who can really do full lung function testing with you before surgery is really a great way to see, are there areas where I'm having some restriction? What is my preoperative plan? What does my postoperative plan look like? What are some exercises I can do to improve my postoperative course? And then lastly, as we mentioned, do you recommend that I work with a physical therapist? Or do I work with a psychologist to help manage my fatigue? Again, fatigue is coming from many different areas. It's coming from the neuromuscular junction. It's coming from the destruction at the neuromuscular junction or the deficiencies of our mitochondria as a result of the actual myasthenia gravis itself. It's also coming from a central component. What you've had to deal with and what you had to go through with all of the myasthenia gravis is something that many patients do not have to ever experience or people have to experience their lifetime. And so there's multiple facets to fatigue and exercise fatigability. So if we can treat it from all these different areas, if we can treat it from your immunomodulation, we can treat it with tweaking around your symptomatic therapy with Mestinon, what's the best regimen that works for you? If we can tweak it with doing some light exercise, getting into a program, and then if we could start to add in some of those maybe adjunctive therapies, if they get approved down the road for helping the muscle to improve contractility, how are we going to bring that all together with our psychosocial component to support your care overall? I made it short specifically because I thought there may be questions, some of which I hopefully can answer for you, and also because I know that we're coming into lunch and it's the last day. But again, I want to just voice my great gratitude for all of you sharing your stories with me and for allowing me to be here. It really has been an honor to help with the MGFA this past year. And I am super excited for all of the supports that my young adults, children, and their families are getting from this organization. It has made a world of difference in their care and their lives. So thank you.
Hi there. Thank you so much. I've read some reports of patients having success getting exercise prescribed as medically necessary to get some help from their insurance company on gym memberships or physical therapists. Is that anything you have experience with in your practice?
Yeah, that's a great point. So I don't have this as much with adolescents because typically that isn't a part of their kind of daily activities if you think back to like what you're doing in high school. But personal experience and experience from other young adults, you're correct in saying that if you go onto your insurance company, and particularly this was implemented during the time of COVID, there may be reimbursements available and discounts for different exercise programs. And even if there's something that doesn't fit you, what I would say is that ask your physician for that prescription and go to your insurance company and say, you know, I know you support this program. Medically, my doctor said I cannot do this. Can you have that transferred or can you have some reimbursement available for this particular program? The answer may be no, but at the end of the day, you're also advocating for different forms of exercise that can improve your outcomes in your health. It's a great question.
Get my exercise.
You are getting yours. Thank you so much. I'm wondering if you can talk just a little bit more about the mitochondrial and central component, like in terms of fatigue. And I even wonder about that with like, not just muscle fatigue, but sort of that energy. Oh my God, systemic energy fatigue.
Yeah. I will say that this knowledge doesn't come from autoimmune myasthenia gravis alone, but I treat a lot of children with congenital myasthenic syndrome. And I also treat other neuromuscular disorders such as myotonic dystrophy, congenital myopathies, and spinal muscular atrophy. And the interesting thing is that even as there have been treatments targeted for those, like we talk about with immune therapies from autoimmune myasthenia gravis, the fatigue persists. And so what you see is that when we alter the membrane of the muscle, that actually causes what we call downstream effects inside the muscle cell itself that can alter the mitochondria. So it's unfortunately this time a little bit of an under-researched area. There are a lot of patient groups and advocates in all of these different disease domains who will sometimes use mitochondrial supplements that they may say help them. The conversations I have with my families is I'm okay if you try anything that's not going to harm your child or your young adult, as long as you tell me about it. And so there are some patients who will advocate for taking things like coenzyme Q10, which is available over the counter. It's a mitochondrial supplement. And some patients I've talked to have said it's helped with fatigability. There's also another mitochondrial supplement that's readily available called vitamin B6, which helps kind of our mitochondria produce energy. It's one of those cofactors. And again, those are two supplements that are available over the counter, thought very benign, safe, can be taken in higher dose regimens with not much difficulty, and may be helpful. And so it's worth a try. That being said, I think it's an area that we really need to understand better. And what I've seen from other disease processes, what we'll probably get to in the point with autoimmune myasthenia gravis, I hope, is that we fix the problem at the neuromuscular junction and we still see maybe fatigue as a factor. And so then we start to treat that in other ways, which is what we're seeing with that molecule that's looking to block the chloride channel as well. Oh, and the central fatigue, sorry. Central fatigue, that's a great question. And I think that we don't really understand that too well. Other than to talk about kind of like the mind-body connection. And so a lot of the studies that looked at central fatigue, and they've looked at this in other autoimmune diseases like multiple sclerosis, inflammatory bowel disease, it seems that even when you control for level of activity, that fatigue persists. Again, I think that really is a proponent for talking about the multifaceted approach to care, including the psychosocial component and talking to other people with the disease, as well as talking potentially to a therapist if need be. I wish we had a better understanding of that, but I think that's something that is probably happening on the molecular level and maybe in the level of the mitochondria that we just don't understand fully. I'm sorry, I'm trying to see people. It's pretty bright up here. I apologize. Yep, I see you.
This may be a subjective question, but how can we tell the difference between bad MG fatigue and good exercise fatigue, especially as you're actively exercising?
That is a really great question. And so that is really why I'm a proponent of the low and slow. And so I will say that, it takes a long time for our bodies to understand what our fatigability is, both with exercise and then both from a new onset of disease. And so this is something that my adolescents, it takes them sometimes years to kind of identify until they don't push themselves. I always think that if you start with a low and slow approach of a small amount of aerobic activity, a small amount of even isometric resistance training, then it's probably easier for you to start to tell when those two diverge. That being said, it is really a hard thing to discern. I would say that sometimes also, if this is something that's okay with your physician, depending on your level of fatigability and exercise, fatigability, what I often tell young adults is that I'm okay with them taking an extra dose of their Mestinon prior to a volleyball game. If you're still having symptoms with that, that means it's time to stop. So it's a little bit of a trial and error, but I thank you for that question because it really is an important one to try to distinguish, and I wish I had a better way.
Hey, just one more question.
A quick question. I've been in physical therapy since January for pain after a long flight for work. And so my question is, a lot of us complain of pain, but I'm okay after physical therapy, but only until that exercise wears off. And when I sit again, I'm having that same pain. For people who have excessive pain from sitting, even what most people consider normal periods of time, do you have any specific types of exercise you would recommend that maybe our physical therapist isn't getting? Because over and over for months, it's just not something that's consistently helpful.
Oh, that's a great question. I wish I had an answer for you. It's hard without knowing a little bit more. I would say that as all of us have experienced, and some of our wonderful panel presenters said yesterday, sometimes it takes a little bit of time to find the best fit, right? So sometimes you have to go through a few doctors. I would say sometimes maybe you have to go through a few physical therapists or therapists. And so it might be something that if you're still experiencing symptoms and not finding relief, that maybe you try a different person, get a different opinion and see what may work for you. Anyone else?
Thank you. Thank you very much, Dr. Wright. Very appreciative.
So Dr. Wright is going to catch a flight, but before she leaves this room, I just want to give her a very sincere thank you from MGFA. And I want to let you all know that at a late date, we changed our agenda around a bit. She changed her schedule to give this talk because we felt it was so important to have a talk on movement. And she also was up at 4:30 on a call this morning, opening up a trial. So please give her a round of applause. Okay, so before I make closing remarks, we're going to do that because we know after the last session, people are going to need to leave to catch flights and everything. So I'll do some closing remarks, say our goodbyes, we'll have lunch, and then we'll come back in for that last session. Again, I strongly encourage everybody, if you can, and if you've already planned to, thank you, to stay for that last session. But first of all, I do want to mention something that I should have done earlier, is that we have so many newly diagnosed folks here today. We have so many new community members joining us. For those, a lot of people came in from Arizona. So for those of you, I want you to know that your support group leader is actually here today. So I'd like to ask Kim to come up and just introduce herself quickly. Her name is Kim Vigil, and now you will hear a little bit from her, and you'll have access to her, and it'll be great for people to plug in.
Thank you so much.
Of course.
Hi, I know some of you I've met and some of you I haven't, but my name is Kim Vigil. I run a support group every month, the last Tuesday of the month. It is Zoom, so everyone is welcome to join. We are Pacific time until the time zone changes, so that might be late for some of you, but For those of you in Arizona, I just wanted a couple of minutes to say thank you for coming. And I'm sorry that we didn't know that you were here local, and I'm glad that we connected. So my information is on the website, but for those of you that are here local, my phone number, if you want to write it down, is 303-253-5255. Again, it's 303-253-5255. And I made an easy email for my MG stuff. It's mgkimv@gmail. So if you have questions, if you need anything, if you're out of the area and you need support, I can help connect you if you can't find what you're looking for. But I just wanted to make sure people that were here local that didn't know we have a support group know that we do, and we're here, and I'm glad to meet you. Yes. Sure. It's 303-253-5255. Thank you. Thank you so much.
Awesome. That's what we're here to do, is make those connections. And that is very daring, giving your phone number out to 1,000 people. Okay, and I'd like to do one more acknowledgement. I want to acknowledge somebody who is a caregiver. She's actually here with her mother who lives with MG. And I want to acknowledge Erin Rose. Erin Rose, can you please stand up? Erin is going to be taking over MGFA Caregivers Support Group, and she's actually going to be starting up a brand new support group for us for adolescents. So it's very special. Thank you. Okay, this is the long goodbye. This part makes me sad. This conference goes by fast. It feels like it goes by fast, but we pack so much in a couple days. And again, I just want to say to all of you from the bottom of our hearts, thank you so much for attending. Thank you so much to the folks, the 650 people who attended virtually. My gosh, thank you. Thank you for tuning in, and thank you for being a part of this community. Most of all, thank you for inviting us into your lives, because that's what you do when you become part of a community or you volunteer. And we have so many different stakeholders in this community, and you heard us talk about them. We have the volunteers, we have the board members, we have the industry partners, the sponsors, we have donors. You're inviting us into your lives, and that is quite special and meaningful, and we just really appreciate that tremendously. So thank you for that. I also want to thank, again, the steering committee. You can never thank folks enough for the countless hours, time, effort, expertise, guidance that they lend. So thank you to the steering committee. If we have any steering committee members left at this late hour, can you please stand so you can get acknowledged? Certainly, thank you to all of our speakers. Can't have a program without great speakers, so thank you to all of our speakers. Thank you to all of our sponsors. Our sponsors are just so generous. This is our largest program of the year, but we have so many events and programs that we host, and they show up for everything. So thank you to our very generous sponsors. Thank you for spending time with them in the experience rooms, in the exhibitor hall. I know how much it means to them. They just love this time with the community members. So thank you, thank you, thank you. Thank you to all of our volunteers again that you met earlier who were here. Long-time volunteers, certainly, and also the volunteers that were here today over the last few days, directing you, helping at registration. I mean, you guys, it's very hard to pull off an event with a staff of 15. So thank you to all those critical volunteers. It's very critical to our work. Yeah. I should have prefaced this by saying now it's time to clap, because that's really what we're doing. Okay, and then maybe the biggest round of applause for the person who oversaw this whole event, and that is Jenna Mavallo. If you love this conference, raise your hands for Jenna. We send a survey out after every program and event that we host. I sure do hope that you fill the survey out. It's the only way that we can learn and get better and have room for improvement. And that's really important to us. We don't like to maintain, and we don't like to think that we do everything just right or that we have all the answers. This conference is for you. It's for the community. So please tell us how we're doing and what you'd like to see and what you'd like to hear about, because it's all for you. So you can tell us what you thought at this, you scan this QR code and you can go right to that. I'm going to give you some time. The lights are so bright, I can't really see you, so I don't know if the phones are up or not. Good. I see phones. Okay. Phone's good. Drum roll. I love it. Love it. Save the date for the 2026 MGFA National Patient Conference at the Margaritaville Resort in Hollywood, Florida. April 12th to April 14th. We're going to take you back to a resort. We're going to have you right on a boardwalk and the beach. And we're just going to have a really nice, relaxing time together again with lots of education and tons of friends. Please save the date for the 2026 conference. But with that said, this is definitely not a see you next year. That's not how this relationship works. We want to stay in touch. We want to stay connected. Strongly encourage you, for all the friends that you made over these last few days, stay in touch with them. You're part of a community, club, tribe, whatever you want to call it or refer to it as, you are part of it. So I highly encourage that. Don't lose those connections. They're just way too meaningful and powerful. You need each other and we need you. We all need each other. So stay in touch with us and our team. If you're interested in becoming more involved with the organization, certainly reach out. We have lots of ways to plug in and we would love that. So with that said, thank you so much. I hope that you had a wonderful few days. I wish you all very safe travels back home. And I can't wait until the next time when we meet again. So thank you, thank you, thank you.